Hi, everybody. I am bringing you the code update as of today, August 11th, 2021. So let me go ahead and share my screen with all of you. I just updated you guys a few days back. And so some interesting changes, some good and some not so great. You can see that overall globally, South America is decreasing. Cuba and the Middle East is still rising. Rises here in the US and California continue. Daily vaccination rate is increased to 0.74 million in the US, and 64% of California is fully vaccinated. There is a slight increase still in mortality in the US and California. When we look at vaccination, the US has dropped another spot in the overall list, with Western Europe continuing to do a little bit better than we are at vaccination. You can see that 167 million approximately people are fully vaccinated now, and we're doing a little bit better in the age groups under 65. You can see that we are averaging 739,000 average doses per day across the US, and that overall Pfizer does have a little bit of an increased share of the market. This projection of when 100% of the US population is going to be fully vaccinated continues to increase, increasingly come closer to us. So 90% on March 4th now, which is a little bit better than the last time. You can see here, I've starred the states that have significant increases in vaccination over the last 2 weeks, which is great. You can see sort of all around that Southeast center, more vaccination is occurring. Unfortunately, these areas that I've circled really have not had any significant change in their vaccination rates over the last month and continue to have very low levels of overall vaccination in their population. You can see in California, daily vaccination rate is at 89,000 on a rolling average, 7-day average. And that in Santa Clara County, we're increasing our overall fully vaccinated population to 81.3%. When you look at cases globally, again, we've outstripped the 200 million mark, but thankfully mortality has not kept up with this. And that's because overall we do know how to treat the infection better. And so even though people are still getting disease, still getting hospitalized, we are seeing that we are able to treat this better in the hospitals. And of course, as vaccination rates increase, less and less people are getting disease severe enough to get hospitalized in the first place. Overall, global cases do continue to increase, with 644,877 being the 7-day average. And again, compared to the EU, we continue to increase and they continue their turnaround. This is an interesting slide that I find a few different points to talk about. Number one, we see that very sharp, almost exponential rise of cases in Cuba looks like it may perhaps finally be stabilizing and finding a downturn, which is wonderful for them. And then you can see that the UK, they did have a nice long downturn, but over the last few days have had a little bit of an upswing again in cases. And when you compare two countries, Israel up here and Chile down here, you can see an interesting dichotomy where both of these countries have very high rates of their population being vaccinated, and yet the cases in Chile continue to go down and the cases in Israel continue to increase. And this may have to do with multiple factors, such as overall rate of testing in the population, perhaps access to care in the different populations, but also perhaps changes in the variants, and overall how much of the pool of the population is still susceptible to getting sick from these infections. When we look at national cases, you can again see that we continue to increase, and that when you look at the overall map of hotspots, you know, it's not just the Southeast region anymore, although that is definitely the worst and hardest hit. You can now see cases blooming across Texas, the Mountain West, the Northwest, and the West, and Alaska. This is a little bit of a bright spot in that when you look at percent positivity in overall testing per day, we've been on this very sharp rise for the last several days. And now perhaps we're seeing a little bit of a stabilization at this peak. We'll have to see if this continues or it continues to uptrend from there. Another interesting note is that overall, you can see many rising states as far as cases go. But if you look at Missouri and Arkansas, the epicenter at the beginning of this new Delta surge, you can see that they actually have downturns, very slight, but they're there. And that may also reflect this sort of burnout of a susceptible population. Its Delta variant has run its course, and perhaps the surge will naturally fall as we've seen it fall in India. So we'll have to keep an eye on that as well. That's maybe good news. You can see, unfortunately, the Southeast states that continue to rise, they have not seen their downturn yet. As far as cases in California, we do have a persistent increase exceeding our prior July surge in Santa Clara County. We also have an increase, although perhaps stabilizing. And in San Mateo, we also have an increase, but again, perhaps stabilizing. When you look specifically at Stanford, we've had just a slight uptick, but our overall positivity rate is very good, only 0.3%, 0.37% over the last 7 days in students, and only 2.36% positivity rate in faculty, postdocs, and staff. When you look at variants, Delta is, of course, still the largest share, 96% of all cases. When you look at California, you can see that the traditional Delta variant takes up 74.5% of our cases. And then Delta plus variant, which is basically slight mutations within the Delta variant, are now reaching up to 2.8% of our cases. In Santa Clara County, you can see we have 64 cases of AY.1 and 2 of AY.2. You can see, I just learned this in the last week, that all of those 3 mutations, AY.1, 0.2, and 0.3, are collectively considered the Delta plus variant. When you look at hospitalizations, you can see, unfortunately, there is a persistent rise in hospitalizations across the US. This is something that I've added because a lot of friends and colleagues and people online on social media have reached out to ask me about whether they should be worried about pediatric cases. You can see there is a rise in pediatric COVID-19 in this new surge. When you look at this top graph, you can see that the under 12 age group is rising consistently with all other age groups, and as far as new cases on a day-over-day basis. And now you can see in the media, lots of physicians in the Southeast and Texas and Florida and Louisiana talking about how their increased pediatric hospitalization rate is compared to prior surges. So you can see Dr. Mark Klein in New Orleans is saying that children with COVID-19 used to make up 1% of patients hospitalized there. Now they account for about 20%, which is a significant increase in his hospital. There was a really nice article that came out in the San Francisco Chronicle just this morning, sort of covering all what we know about the Delta variant and kids and possible long COVID or long-term symptoms after having COVID-19. And, the long story short is that they think that parents should not be currently concerned in the Bay Area, but they should certainly be on guard. I would say that parents in the Southeast should certainly be concerned, especially in areas where they're not allowing mask mandates and children are soon going to school. They're going to be exposed to each other, the Delta variants. If they don't have masks, then that could potentially be a very concerning situation. As far as hospitalizations overall in California, you can see there is a persistent rise and that they are increasing in Santa Clara County as well. And in San Mateo, it's rising, but perhaps stabilizing over the last couple days. You can see in San Francisco, there continues to be a significant increase in overall hospitalizations and intensive care unit beds being utilized. And in the Bay Area overall, there is a persistent increase with increasing 364 cases over the last 2 weeks in the Bay Area overall. As far as mortality, there does continue to be an increase overall in the US. In California, there has been an uptick, but perhaps a slight drop in the last 4 days or so. We'll have to see if this is going to continue in a nice downward trend or it's just a little jog in an upward rise. Overall in Santa Clara, we continue to do pretty well with only 4 deaths over the last 2 weeks. And that's the bright spot that I will stop on. And I hope this was helpful. And I'll probably make another update in about another 2 weeks from now. So let me know if you have any questions on my page.